Your teenage child has been diagnosed with functional neurological disorder, short for FND, which includes things like non-epileptic seizures or psychogenic non-epileptic seizures, short for NES or PNES. Sometimes it's also called psychogenic non-epileptic episode, PNEE. So many names, but anyway, they're all part of this umbrella term called FND. And now you as a parent might be wondering, well, how is my child's PNES, the non-epileptic seizure, is different from the epileptic seizures? How can doctors tell what your child is having is one or the other? Hi, my name is Dr. Jean Lee. I'm a pediatric psychologist and chronic pain survivor myself. My mission is to help teens and their parents resolve persistent physical symptoms such as chronic pain and FND so that they can get their life back and feel like normal again. Because I truly believe every single teen deserves so much more in their lives. If you're new to this channel, make sure to grab a free PDF parenting guide on how to help your teen who is struggling with chronic pain or FND at home. And it's completely free, and then grab the link below. All right, so today's video is all about how can you make a difference between epileptic seizures and non-epileptic seizures. And before I talk about that, let me give you kind of guideline of what each of these things are. Starting with FND. So again, PNES is part of the diagnosis for FND, which is a functional neurological disorder. And it is essentially this cross-wired problems between the brain and the body when structurally there is quote unquote nothing wrong with physiological condition. And believe it or not, FND is the second most common diagnosis you would get in a neurology clinic, right next to headaches and migraines. And if you're wondering why your child is struggling with FND or just got diagnosis with FND, then rest assured, it is definitely treatable, manageable, and or solvable issue, but it's not just one thing that is causing the FND. It's not just one injury, it's not just one thing, it's not just one stress or anxiety or trauma. It is biological, psychological, social phenomenon, which is called biopsychosocial phenomenon. And I have videos about what they are in details, so check that video out as well. Now, what is epilepsy? Epilepsy is essentially a brain disorder that has recurring seizure episodes and symptoms. So if you just have one seizure, that doesn't necessarily mean that you have an epilepsy. You have to have a certain numbers of seizures within a certain period of time to be diagnosed with an epilepsy. And epilepsy is also a pretty common diagnosis, and just like FND, there are so many different types of seizures. But those are two different things, epilepsy and then functional neurological disorder. So I want to talk about 8 different signs that you can potentially tell the difference between PNES, also known as FND, and epileptic seizures. And those are video EEG, onset, recovery, eyes, tongue, jerky movement, twitching, and emotional outbursts. Okay, so I'm going to go in one by one. So the first one is if your child is struggling with PNES, then chances are the video EEG will not show much of the brain activity, as opposed to your child is having epileptic seizures. And number 2, the onset can be, so onset is how the episode starts, can be pretty gradual, meaning that your child might be showing some signs here and there, bits and pieces, and then gradually becoming this full-on seizure episode, as opposed to kids with epilepsy, their onset tend to be very quick and sudden. Okay, and number 3 is that after the episode is over, then kids with PNES tend to have fairly quick recovery, like within seconds and minutes, as opposed to kids with epilepsy tend to have longer recovery time, where they would feel tired and extreme headaches and feeling drowsy and things like that. And number 3, during the episode, the kids with FND or PNES tend to have their eyes shut closed, whereas the kids with epilepsy that's not necessarily the case. So their eyes tend to be more open and not necessarily shut closed. Okay. The other one is, again, during the episode, the kids with PNES tend to have their tongue biting, or the tip of the tongue biting, whereas kids with epilepsy, they're less likely to have that experience. And then jerky movements. So depending on the type of seizures, the kids with epilepsy also would have a jerky movements. However, kids who have PNES tend to have this sort of abnormal jerky movements, such as hip and pelvis area really high thrusting, or neck and face bending backwards like that, and or face is shaking side to side. Those are less likely to be witnessed during the episode of epileptic seizures. Okay. The next one is kind of similar to the jerky movements. Kiddos who have a PNES tend to have this twitching arms and legs for a longer period of time. How long? We're talking about at least 2 minutes and plus. Whereas kids with epileptic seizures, less likely to have that jerky, twitchy arms and legs movement. And lastly, but not necessarily the least, the kids with PNES tend to have a sudden emotional outburst during the episode, like uncontrollable crying or screaming and yelling, as opposed to kiddos who have epileptic seizures. They are less likely to have those sudden emotional outbursts. Now, can someone, for instance, your child, have both epilepsy and PNES at the same time? Yes, your child can have two diagnoses at the same time. Can they happen at the same time? Well, less likely it's one or the other. However, statistically speaking, 1 in every 20 individuals are said to have both diagnoses of epilepsy and PNES. So just because your child has one or the other doesn't necessarily guarantee your child must be having the other diagnosis, but that is a possibility. So this is why neurologists are going through so many different tests and clinical interviews and gathering information to make sure that they're having a correct diagnosis when they communicate that diagnosis with you. But for you, it's easier to get confused which one is which, because they, on the face value, they look very similar. But those are the typical 8 signs that are shown in teens who have FND or PNES, as opposed to adolescents who have epilepsy and then when they're having epileptic seizures. Now, that doesn't necessarily mean, oh my gosh, my child just closed her eyes when she had this episode. Well, that one thing doesn't necessarily guarantee that your child is having the PNES episode. Okay, it's a combination of all of these things and then some information that the providers are likely to be gathering to get to the diagnosis. So what can you do as a parent? Number one, make sure the FND diagnosis is indeed correct. So that means you have to see a specialist who is trained in FND and or neurologist to describe why they got to the conclusion of FND diagnosis. So then you have a better understanding of where this diagnosis is coming from, because it can be confusing, right? And number two, once your child gets the diagnosis of FND, that includes PNES, then my suggestion is to start working with the FND specialist as soon as possible. The sooner you can start working with the specialist, the better outcome your child would be having. In fact, there's a lot of costs associated with delayed treatment initiation. So I urge you to find a specialist as much as possible and then start working with that specialist, okay? Rather than refusing to get that diagnosis of FND and then chasing after this rabbit hole of, oh, there's gotta be this hidden diagnosis, that just because this one day of video EEG not catching my child's brain activity doesn't necessarily mean that my child has FND or PNES, therefore I need to go see 10 more different neurologists until I get the answer I'm looking for. Well, that's always an option. However, think about how the child continues to suffer and struggle in the meantime. So in my mind, even if your child may be actually having epilepsy, like I mentioned, there are some overlaps, right, for some people. If your child gets a diagnosis of FND or PNES, I would say start working on that aspect right away. And then you can also look for if there are other conditions going on. But you don't have to delay the treatment if you get the diagnosis. Now, I hope this was helpful. And let me know what you have found in your child experience of witnessing PNES and or epileptic seizures and how you feel like they're different in your own eyes. And I'm really curious to know that. Now, if you're a dedicated parent and bright and compassionate teenagers are ready to take an action in resolving persistent physical symptoms such as FND and chronic pain through step-by-step actionable solutions, then you might be a good candidate for my program. Click the link below to speak with me directly today and figure out if you qualify for the program. Thank you so much for watching this video, and I will see you in the next video.